Hello, I'm Dr.Aniketh Venkataram. So what is migraine surgery? As you might have seen in our previous videos, migraine surgery is done for patients suffering from migraine who have trigger sites. As we explained, trigger sites are the starting point of a migraine. There are points in your face underneath the skin where the nerve gets irritated and that triggers the migraine. So we first identify the trigger site, and then if the patient's a good candidate for surgery, we plan them for migraine surgery. So in migraine surgery, what we're essentially doing is we are releasing this trigger nerve from whatever is irritating it. So if your trigger nerve is in the above your eyebrow, we make a small cut in your upper eyelid. Through that, we go to the nerve and we release it from whatever is irritating it. So here two things to understand. One, this is not a brain surgery. We're not operating on your brain inside your skull. This is a facial surgery. The surgery is done just under the skin. So this is an interesting story as to how this first started. This was first discovered by a plastic surgeon. When a plastic surgeon was doing brow lifts, where you lift the eyebrow in older ladies whose eyebrows have fallen down. When he did this, he was releasing everything under the skin, and because of that, he released the trigger nerves as well. So a lot of these women who had these brow lifts told him that their migraines have gone away after the brow lift surgery. This led him to investigate this and found about the trigger sites and everything. So this is how the migraine surgery was first born. So this is not a big brain surgery. This is a surgery just under the skin. It can be done under local anesthesia or a daycare general anesthesia depending on how many trigger nerves they are. There is no need for admission. You come get it done, go home the same day. There are no large visible incisions. Each of the trigger sites can be handled without any noticeable incisions. So for the supraorbital nerve, we make a cut in the upper eyelid and that gets hidden in your eyelid crease. No one can see it. For the temporal trigger point, we make a cut inside the hair bearing area so that scar comes inside the hair, no one can see it. For the occipital, it's in the back of that, again no one can see it. So we make the cut, we dissect out the irritated trigger nerve, we release it from everything that is irritating it, and then we put some stitches and close it. There is no admission, you go home the same day. You'll start seeing the effects of the surgery a few days later. You can be pretty normal within a couple of days itself. There might be a little bit of swelling, but you feel perfectly fine within a couple of days. You can work from home within a couple of days. If there are any stitches to be removed, those are removed after 7 days. And pretty much after a week, no one can make out that you had the surgery done and you can be completely normal.